I'm Dr. Jeanelle de Gruchy, and I'm Director of Public Health for Tameside. COVID cases are unfortunately continuing to rise rapidly in Tameside. 2 weeks ago, our rate was a high 200 per 100,000 people. It is now double that at over 440 per 100,000 people, the highest it's been for months. That's at least 1,000 people that we know who have been infected by COVID in the last week. We're also seeing an increase in infections in older people as part of that infection rate. And we are now seeing an increase in cases of COVID patients in hospital and in intensive care in Tameside. So it's really important people have their vaccination for protection from being hospitalized. Apart from this concerning situation with the hospital, we know that we're seeing a large number of outbreaks of COVID in our schools and in other workplaces, with many children missing school and businesses struggling with outbreaks and with staff off. This shows that the pandemic is far from over and that everyone needs to remain vigilant, because what we do know is that Delta variant is so much faster in its spread, with an infected person being able to infect many more than previously. So we all need to do everything we can to stop its spread. The government has announced that it is set to move ahead with step 4 of the roadmap on 19th of July. And that means that their legal restrictions on social contact and other events will be removed, and the remaining closed settings such as nightclubs will be able to reopen. Please remember that until 19th of July, we still have restrictions in place, and the more we do now to stop COVID transmission, the better position we will be when restrictions are lifted from July 19th. At that point, the government will encourage people to make their own informed decisions about how to manage the risk to themselves and others. I'd really urge everyone to be responsible in taking steps to continue to protect themselves and others when those restrictions are lifted. I believe that we need to continue to behave to protect ourselves and others. I think it still needs to be a collective, a community effort. I think it's really important. For me, the really good news is that vaccines are significantly reducing the link between infections and severe disease and death, and they are also reducing the amount that COVID is spreading. So I'd strongly encourage all adults, that's everyone over 18, to get vaccinated, double vaccinated. It's never too late to get your first dose. And it's also important you get your second dose, because it's the 2 doses that are proving highly effective against Delta variant. And it's the 2 doses that are going to give you the maximum possible protection. So we're doing what we can to make getting your vaccine easier for you. Our vaccine hubs are now open to just drop in, so you can get your jab, first or second dose, with no appointment or ID required. The locations, the dates, the times for these can be found on our website at www.tameside.gov.uk/COVID vaccine. Our vaccine van is also continuing to visit the heart of our communities to make it even easier to get the jab. Again, you can just turn up to these pop-up clinics with no appointment or ID needed, and for your first or your second dose. To get the latest schedule for that, again, visit the website www.tameside.gov.uk/COVID vaccine. Or look out for the mobile clinics being advertised on social media or on leaflets and posters in your neighbourhood. If you want to book an appointment at one of the hubs or pop-ups, just head straight to the booking site www.tamesideandglossop.nhsvaccinations.co.uk or call your GP practice. Alternatively, you can book at the mass vaccination centres by visiting www.nhsvaccinations.co.uk www.nhs.uk/coronavirus-vaccination, or by calling 119. So there are quite a few ways in which you can get vaccinated, and I encourage you to find the way that's easiest for you and go ahead and get your first jab and then your second jab. Vaccination, 2 doses, is really the most important thing. Then we all need to reduce the chance that we are spreading the infection. Remember, we have very high levels of infection and not everyone is protected by vaccination. So please, do your bit to protect others. Remember to continue with the basic measures of washing your hands, wearing your face covering, socially distancing as much as possible still, and letting in fresh air or being outdoors. I'd also urge you to still try to work from home as much as you can. Be cautious when meeting others who are not in your household, especially if it was indoors. Try to socialize outdoors and just generally minimize your travel and going out and about. If you do have symptoms of COVID, such as a fever, a new continuous cough or loss or change of taste or smell, then you need to book a PCR test. So to do that, visit www.nhs.uk/coronavirus for further information. Then finally, we all need to test ourselves regularly. Please use the rapid tests twice a week, as hopefully you have been doing. And this is to check whether you may be infected with COVID, but don't actually have symptoms. This can be the case even if you have been vaccinated. So you can still be infecting others, and it's important to know whether you actually have COVID or not. Home rapid tests can be ordered online or collected from different venues in Tameside. And for details of that, go to www.tameside.gov.uk/rapid testing. It's been a really challenging time for everyone, and I'm sure we will all welcome the opportunity of more freedom from July 19th. But we need to approach this next step really cautiously and responsibly, as I have to say the risk of illness and disruption to our lives and the economy is still there. Please take care, everyone.